Good morning to everyone. We're going to talk about activity of oral ALS-008176 in a respiratory syncytial virus challenge study. So the presenter is Teresa von Veresolis, and we're going to give a little definition of what is RSV. RSV, or respiratory syncytial virus, is a very common virus that leads to mild cold-like symptoms in adults and older healthy children, and it's mostly common that most children have been infected with the virus by age 2. RSV can cause severe infection in some people, especially premature babies, older adults, infants, and adults with heart and lung disease, or anyone with a very weak immune system, cold as well, and immunocompromised. We're going to put a video that explains the physiology of RSV.
Remember we said respiratory viruses can infect the upper or lower respiratory tract? Well, now we're going to talk about one that likes to infect the lower respiratory tract, where it causes bronchiolitis and pneumonia. And remember that these, unlike URIs, can kill. This virus is called respiratory syncytial virus, or RSV. RSV almost always affects infants less than a year old. It causes more than 80% of lower respiratory tract infections in this group. And by their second birthday, almost all children will have been infected by RSV. Occasionally, adults can develop symptomatic RSV infections, but it's usually mild and isolated to the upper respiratory tract. So what are the symptoms? Well, since it starts in the upper respiratory tract, initially you might see rhinorrhea, or runny nose, congestion, and sneezing. And then over 1 to 3 days it spreads to the lower airways, reaching the terminal bronchioles, where it causes cough. And the problems arise when the bronchioles become swollen and plugged with mucus. And at that point it gets harder and harder to move air through the bronchioles. So then what you might see is tachypnea, which means fast breathing because the infant is trying to get more air into the alveoli through that resistance. You'll see retractions, which refers to the inward movement of the chest wall. That's a reflection of the high negative pressures that you're trying to.
And there is a video of a professional talking about RSV in children.
RSV is a virus that we actually all probably get infected with every winter that makes us feel bad but doesn't make us very sick. It just so happens that in very predisposed populations, i.e. former premature babies and babies with some lung disease, it can make them pretty sick. RSV can also cause a term baby who's not predisposed to get pretty sick. The RSV rates are the highest in the late fall months through the early spring months. This year we started seeing it earlier, to the extent that we have more patients hospitalized earlier, and we've started up some of our specific preventative measures earlier than we typically do. There are little viruses and droplets that get in the nose or in the eyes and cause an infection starting there. RSV starts off mostly with cold-like symptoms, just like any other cold that you and I know about. When it starts to become a problem in our former premature infants is when it gets in their lower airway. So a couple things that you'll see, they're just breathing harder. They may not be quite as pink as they typically are too. One very significant complication of RSV disease in a former premature infant is they can forget to breathe. It's called apnea. For parents that are concerned that their babies have symptoms consistent with RSV, number one, if things are going well, they're eating well and breathing well, they're just having a little bit of a cold, do not overreact. Give your pediatrician a call. Obviously, if your baby is sick enough so that they forget to breathe and you're worried about that, or they're breathing really hard, really fast, and you're very concerned about them, then they need to get to medical care more quickly, and they should go to an emergency room. And if they're really sick, you should actually call an ambulance.
So there's some risk factors to consider. First of all, in adults, it's more like being near tobacco smoke, also being or having school-aged children, and attending daycare. So we talk about RSV. Now we're going to talk about what is this ALS bioavailable. So ALS-008176 is an orally bioavailable prodrug of the novel RSV replication inhibitor ALS-008112, a cytidine nucleoside analog. ALS-008112 enters various types of epithelial cells in the respiratory tract and is subsequently phosphorylate to form an intracellular nucleoside 3-phosphate with a half-life of approximately 29 hours. The nucleoside 3-phosphate analog inhibits RSV replication by means of chain termination. And here's a percentage that shows in the study that this presentation has been made, that it's a comparison between placebo and the bioavailable, and it says that the bioavailable in different doses is better than placebo, and it's getting better if you get a higher dose in less time. So there's going to be pros and cons. For pros or advantages, we can say that there's now new studies to compare effectiveness of different treatments, preventing the advance to a dangerous state of RSV, controlling the mutation and replication cycle with experimental evidence, and there's a good prognosis and protecting risk groups that acquire the disease, and that's guaranteed, like school-age children with this study. Well, there's a cons. The cons are that adverse events that appear over time and by not following the dose, the laboratory results not being all specific, and having a balance of health and in other organs make the drugs unuseful, like having lung cancer or cirrhosis in case of the liver. And another cons, it's about the price of the vaccine and the bioavailable. There's a video that explains this.
The sign on the door says, "Stop, are you sick?" That's because the baby inside has a fragile immune system. Charlie was born too early at just 26 weeks. He spent the first 3 months of his life in the hospital.
Charlie, it's beautiful.
This was his first winter at home, and his mother has been trying to protect him from...
The application in medicine of this ALS is that the mechanism of action of ALS-008176, which inhibits RSV replication within cells already infected, in addition to protecting uninfected host respiratory epithelial cells. The action of drug may not only protect the virus replication, but also prevent other common respiratory diseases such as pneumonia, bronchiolitis, tuberculosis, and ARDS. This is most likely to help in a population of third world development that have a count of more than 70% of incidence of tuberculosis, slowing the process of infection. The issue in Ecuador reveals in some studies that studies in Quito revealed in 2017 that 78.5% of respiratory disease were related to RSV, and there will be benefits of using RSV vaccines, biovailables, and improving nutrition on children in the future, but until now it's still under study. And for the conclusion, we can see that RSV is an issue that transcends over all the countries, but has a predominant group of affection children and people with low resources, complicating the lifestyle development of families. Nowadays, there still exists a high amount of people being affected by RSV, even though studies have progressed to create new drugs to protect from RSV and other associated diseases, and for the future, plan and effective to eradicate RSV is undergoing further studies.